COVID-19 is the disease caused by the new coronavirus that emerged in China in December 2019. COVID-19 appeared in Wuhan, a city in China in December 2019. Although health officials are still tracing the exact source of this new coronavirus, early hypotheses thought it may be linked to a seafood market in Wuhan, China. Some people who visited the market developed viral pneumonia caused by the new coronavirus. A study that came out on January 25, 2020 notes that the individual with the first reported case became ill on December 1, 2019 and had no link to the seafood market. Investigations are going as to how this virus originated and spread. The COVID-19 virus can be spread through contact with certain bodily fluids, such as droplets in a cough. It might also be caused by touching something an infected person has touched and then touching your hand to your mouth, nose, or eyes. Coronavirus can infect all ages, young and old, adults, children, babies, men and women. Even healthy people can get a virus. If you have symptoms, you've been exposed to the virus that caused COVID-19 or you've been diagnosed with COVID-19. Coronavirus prevention. Until now, there is no vaccine to prevent coronavirus infection or COVID-19. Therefore, the best prevention method is to avoid the factors that can cause you to be infected with this virus. The first is avoid traveling to public places that are crowded with visitors or social distancing. And then use a mask when on the movie in public places or crowds. And then wash your hands regularly with soap and water or hand sanitizer containing at least 16% alcohol after doing activities outside the home or public places. And then don't touch the eyes, mouth, and nose before washing hands. Avoid contact with animals, especially wild animals. In case of contact with animals, wash your hands afterwards. Cook the meat until it is completely cooked before consumption. Cover your mouth and nose with a tissue when you cough or sneeze. Then throw the tissue in the trash. Avoid being close to people who are sick with a fever, cough, or runny nose. Keep clean objects that are often touched and environmental cleanliness. For people suspect of being affected by COVID-19 or included in the ODP or monitored person category, there are steps that can be taken so that the coronavirus is not transmitted to others. Namely, don't leave the house except for treatment. Check with your doctor only if you experience symptoms or respiratory distress accompanied by fever, or meet PDP criteria, or the patient is under surveillance. Try to stay apart from other people for a while. If it is not possible, use a bedroom and bathroom that is different from what others use. Prohibit and prevent others from visiting or visiting you until you are completely healed. As much as possible, do not have meetings with people who are sick. Avoid sharing the use of cutlery and drinking equipment, toiletries and sleeping equipment with others. Wear a mask and gloves when in a public place or with someone else. Use tissue to cover your mouth and nose when coughing or sneezing. Then immediately throw the tissue in the trash. Since the outbreak of the COVID-19 epidemic, Indonesia has actually been one of the countries classified as newly infected with this virus. Even so, in a short time, the number one of people who are positively infected by this virus is increasing in a relative past time. The spread of coronavirus infection in Indonesia alone can be divided into several clusters. The first cluster is the Jakarta cluster, which is sourced from foreigners from Japan who are positively corona and visit Jakarta. These foreigners transmit the virus to patients and several others. The second cluster is the imported case. That is, the patients are infected while abroad and are detected when entering Indonesia. There are several Indonesian citizens and foreigners who entered into this cluster, and to date, recorded one foreigner from England who has died from the coronavirus in Bali. In Islamic perspective, there are two debates that arise related to the coronavirus. First, for God Almighty, don't be afraid of corona. This statement is true but flawed in logic or person. True because it is very clearly a fate of only Allah. False because God cannot compare to corona. But this logic is not without theological basis. This logic of thought entered into the understanding of Jabariyah in Islamic theology. In essence, this understanding has the belief that everything has been arranged by Allah subhanahu wa ta'ala. So there is no endeavor for humans. Humans only live their fate. Second, coronavirus is very dangerous. Humans must endeavor or attempt to prevent transmission. This statement is true, and many endeavor to use masks, wear hand sanitizer, greetings, elbows. This endeavor also actually relies on the understanding of the Qadariyah theology. This principle believes in principle that humans have the freedom to determine their own way of life. Thank you so much for watching my video. I really hope my video can give information and useful for all of you. Please stay at home and keep health for us. Assalamualaikum warahmatullahi wabarakatuh.